Okay, good afternoon and happy New Opportunities 2024, everyone. I hope you all had an excellent holiday, as did I. And we're going to get started in the new year. We're so glad that you are able to join us in our social emotional workshop today. We've got a really great topic and subject matter that we're going to be discussing, bipolar disorder and schizophrenia. This is a subject that we have not tackled yet. So we're looking forward to the information and all of your questions that I'm sure you'll have at the end of the session. Um, just to go over some housekeeping, for those of you that are interested in receiving your sketch credits, please put your PIC number and your name and department in the chat, and I will make sure that you receive all of your sketch credits. And with all of that being said, welcome back, Brandy, Brenda. Um, we're so glad to have you. Take it away.
Hi, my name is Brandy. Here I have Liliana with me, and today we are going to be discussing bipolar disorder and schizophrenia.
Great, so I'm going to be leading today's presentation. So first we're going to be talking about bipolar disorder. So bipolar disorder is a mental health condition that causes extreme mood swings of emotional highs, which we refer to as mania, and extreme lows, which we refer to as depression. So these mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. So all of these symptoms cause changes in a person's mood, energy, and just their overall ability to function. In addition to that, it can disrupt a person's relationship with loved ones and cause difficulty in working or going to school. As we may know with many mental health issues, this does impair your day-to-day function if severe, or even if moderate, it can still affect your day-to-day functions with the symptoms. So bipolar disorder includes 3 different diagnoses: bipolar 1, bipolar 2, and cyclothymic disorder, which we'll get into in a bit, the different classifications right here. So bipolar 1, this is characterized by the presence of at least one major depressive episode and one manic episode. So a manic episode, people with bipolar 1, they experience an increase in energy and they can feel on top of the world, like this very euphoric feeling that they get, and or it can manifest as uncomfortability and irritability in their mood. So they have this mania, and then also they experience a depressive or hypomanic episode, which is this bottom bullet point on the left. So this is periods of a neutral mood, or periods of more of a low. So they have that really, really high, and then they drop down and it kind of plateaus, and then they have that high again and then it plateaus with bipolar 1. So with bipolar 2, you have the presence of the hypomanic episode and a flip between depressive and manic behaviors. So a diagnosis requires someone to have at least one major depressive episode and at least one hypomanic episode. So people with bipolar 2, they frequently have co-occurring mental illnesses such as anxiety disorder or substance use disorder. So this one is a bit different from bipolar 1 in the sense that they get the hypomanic episode and then they flip between the depressive and the manic behaviors. So cyclothymic disorder is a milder form of bipolar, and it involves many mood swings with hypomania and depressive symptoms that occur frequently. So people with cyclothymia experience emotional ups and downs, but with less severe symptoms than bipolar 1 or 2 disorder. So you still get those swings, but they're going to be less severe and perhaps less frequent. Or I'm sorry, more frequent, but less severe. So going more into manic episodes. So manic episodes is a period of at least 1 week when, like I said, they're very high spirited, they possess more energy than usual, and they have at least 3 of these changes in behavior. So they could either have a decreased need for sleep, an increased or faster speech, uncontrollable racing thoughts, or quickly changing ideas or topics when speaking, getting easily distracted, increased activity, increased risky behavior. So when you think of the word manic, it's very similar to the connotation that it has, but it doesn't necessarily mean manic as in crazy. It means manic as in you're having these quick, impulsive, high energy behaviors. So these behaviors must represent a change from the person's usual behavior and be clear to friends or family. The symptoms must be severe enough to cause dysfunction in work, family, or other social activities. And the symptoms of a manic episode sometimes require a person to receive hospital care to stay safe. If that's how severe their symptoms are, they may have to be hospitalized because of those risky behaviors. And some people also experience disorganized thinking, false beliefs, or hallucinations, again, depending on the severity of the mania itself. Do we have any questions so far, or do we want to stop for questions at the end? Okay, great. Okay, so mania and hypomania. These are periods of overactive and high energy behaviors that can have a significant impact on day-to-day life. So hypomania is the milder version, and this only lasts for a short period of time. And mania refers to the more severe version, and this lasts for a longer, more extended period of time. So manic episodes are distinct periods of time, like I said, and they can be persistently elevated, expansive, or irritable moods, and persistently increased goal-directed activity. So they are noticeable by someone who has excessive involvement in activities that have high potential for painful consequences. A common example that I like to give is overspending. That is one of the symptoms that you can experience with bipolar. You can overspend. Risky driving is another one, substance use, all of those risky behaviors can occur during mania. And because of this, there's an increased risk for suicidal behavior due to incapacitating lack of reasoning and control of the mind because of that impulsivity during this mania. So next, we're going to go into the depressive episodes. So this is major depressive episode that you get in bipolar. So this is a period of at least 2 weeks in which a person can have at least 5 of the following symptoms. So they can experience intense sadness or despair, loss of interest in activities or their hobbies that they once enjoyed, feelings of worthlessness or guilt, fatigue, increased or decreased sleep, increased or decreased appetite, restlessness or slowed speech or movement, difficulty concentrating, and frequent thoughts of death or suicide. So as the word depressive, again, like with manic, that connotation, depressive, depression, it has a lot of the same symptoms as major depressive disorder, but these would only last for at least 2 weeks, and then they would, like I said, drop off. So how to treat bipolar disorder? Bipolar is very complex and multi-leveled mental illness that requires multiple different avenues of treatment. So we have medication. So there are a number of medications, and these include mood stabilizers, antipsychotics, or antidepressants. And the medication really depends on what type of episode you're in, as well as what exactly symptoms you get when you're in that episode, because it does vary from person to person. In addition, you would pair the medication with psychotherapy or just have psychotherapy alone. So that's a vital part of bipolar treatment. And this can be in an individual setting, in a family setting, even in a group setting with other people who have bipolar. And there are different types of therapy. The most common type of therapy that most therapists use is referred to as CBT, or cognitive behavioral therapy. And this is identifying the negative beliefs and replacing them with healthy, positive ones. So what does trigger your bipolar episodes? How can we cope through these bipolar episodes? And how can we manage our stress through these upsetting situations? We have psychoeducation, which is learning about your own condition and knowing how best to serve your disorder with the symptoms that you have. So researching your own disorder and doing treatment through that way. And then you have family focused therapy, which, like I said, that's the family support and the communication with your loved ones. So now we can talk about schizophrenia. So schizophrenia is a mental disorder in which people interpret reality abnormally. So when this is active, symptoms can include delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. However, with treatment, most symptoms of schizophrenia will greatly improve and the likelihood of recurrence can be diminished. Schizophrenia does not mean split personality or multiple personality. This is a very common misconception with this disorder. Schizophrenia is a different disorder. Schizophrenia is something where you experience those delusions, those hallucinations. It's not necessarily a split from your identity, if that makes sense. So most people with schizophrenia are not any more dangerous or violent than people in the general population. They just have these symptoms and they struggle with these symptoms. So with schizophrenia, we have positive symptoms, negative symptoms, and disorganized symptoms. And I really want to emphasize that positive and negative does not mean good or bad. Instead, it means added to or taking away from. So this is not any connotation with the types of symptoms and or anything about what that means. It just is adding to or taking away from. So our positive symptoms, this is when you have hallucinations that aren't real, paranoia, exaggerated or distorted perceptions, beliefs and behaviors, and repetitive movements that are too hard to control. So we're adding those symptoms. Negative symptoms are what is lacking or absent in the person with psychotic disorder. So this is impaired emotional expression, decreased speech, reduced desire to have social contact, or decreased experience of pleasure and in general happiness. Disorganized symptoms refer to the confused or disordered thinking or speech and trouble with logical thinking. This can sometimes be paired with abnormal behavior or abnormal movements. And symptoms of disorganization have been identified as risk factors for poor illness outcome and have a significant negative effect on a person's day-to-day functioning and quality of life. So disorganized symptoms are risk factors for the more severe types of schizophrenia. So this is just an overview of some of the symptoms. This is kind of a breakdown so you can get the unusual or extremely slowed movements, incoherent or disorganized thinking, the hallucinations, and usually this manifests as hearing voices or strange sounds. Delusions are false beliefs that remain unchanged, also commonly manifest as paranoia, isolating behaviors or emotionless facial expressions or speech. And all of this can lead to feeling suspicious, paranoid, afraid, not taking care of yourself, having depression, anxiety, or suicidal thoughts, or even using alcohol, nicotine, other substances to self-medicate these symptoms. And that's where those co-occurring disorders sort of come in. So some definitions related to schizophrenia that you may hear if you're ever referring to this disorder or doing research on it. So psychosis, that's the set of symptoms that when a person with this disorder sort of loses touch with reality due to a disruption in the way that the brain processes information. So when someone experiences a psychotic episode, the person's thoughts and perceptions are disturbed, and the individual may have trouble deciding what is real and what is not. Delusions are fixed false beliefs held despite clear or reasonable evidence that they are not true. Hallucinations are the experience of hearing, seeing, smelling, tasting, or feeling things that are not there. So false sensations. They are vivid and clear with an impression similar to normal perception. So again, it's that difficulty to decipher the difference between reality. And then again, disorganized thinking and speech, disorganized or abnormal motor behavior. Those are the slow movements once again. So schizophrenia-related disorders, so we have schizoaffective disorder, and this is a disorder similar to schizophrenia with severe mood disturbances in addition to that, but people also experience symptoms of depression or bipolar at the same time as the symptoms of schizophrenia. So they have that loss of touch with reality, in addition to either that depression or those mood swings and those personality changes. So schizoaffective disorder, the bipolar type, like I just said, that's paired with the feelings of euphoria, racing thoughts, increased risky behavior, and other symptoms of mania. And then you have the depression type, where you have the feelings of sadness, emptiness, worthlessness that come with depression. Schizophreniform disorder, unlike schizophrenia, this disorder lasts 1 to 6 months instead of the rest of your life. So this is more of a, I don't want to say temporary, but it's not as long lasting of a disorder, and it is a serious psychotic disorder that may be caused by genetics, brain chemistry, or other environmental factors. Then we have delusional disorder, and this involves a person having false beliefs that persist for at least 1 month, typically of a paranoid nature. So within schizophrenia and within all of the symptoms of schizophrenia that you have all of these other disorders that sort of kind of intertwine those main symptoms, but are a little bit different and vary from symptom or disorder to disorder. To continue, we have the brief psychotic disorder. So this is just a psychotic episode with symptoms arising after a major stressor. However, this is not a chronic, long-lasting disorder. So this can last between 1 to 30 days, and then the symptoms completely disappear. You have schizotypal personality disorder, and this is a person who has a difficult time developing close relationships with other people, and they usually have unusual behaviors and learning difficulties. So with schizotypal personality, this is someone who's a bit more closed off, doesn't want to be social, has a hard time interacting in society. And then you have schizoid personality disorder, and this is someone who's aloof from other people and does not show many emotions. So I want to say the typical word that we would use to describe a schizoid personality disorder, we refer to them commonly as hermits. So again, that's that closed offness. So that could be how this disorder sort of manifests. So the DSM-5 diagnostic criteria requires these things to be met in order for someone to be diagnosed with schizophrenia. So you must have 2 or more of the following, each present for a significant portion of time during a 1-month period. So you must have all of these things. You must have delusions, hallucinations, or I'm sorry, you must have 2 or more of the following. So delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. So if you have 2 or more of the following for longer than a 1-month period or less, if successfully treated, then that is one of the criteria. In addition, continuous signs of the disturbance persist for at least 6 months. So this 6-month period must include at least 1 month of symptoms that meet the above criteria once again. And for a significant portion of time since the onset of the disturbance, level of functioning in 1 or more major areas must be below the level achieved prior to the onset. So again, similar to bipolar, we use medication to treat schizophrenia. So medication is actually the cornerstone of schizophrenia treatment, and antipsychotic medications are the most commonly prescribed drug because they are thought to control symptoms by affecting the brain neurotransmitter, or our dopamine levels, right? So when we have that over stimulation of dopamine, sometimes that's when the symptoms of schizophrenia can worsen. So we would use antipsychotic medication to control those brain chemicals. The goal of treatment with antipsychotic medications is to effectively manage signs and symptoms at the lowest possible dose. Other medications may also help, such as antidepressants or anti-anxiety drugs, if they do have those co-occurring disorders or co-occurring symptoms. And it can take several weeks to notice an improvement in symptoms once you are onto medication. And because these medications are antipsychotics, they often do come with serious side effects, which does deter people from taking them. So willingness to cooperate with treatment may affect the drug that is chosen or prescribed to the individual. You can also have psychosocial interventions, which includes individual therapy, like we talked about, social skills training. So this is for the schizotypal and schizoid personalities, improving those social interactions and improving that ability to interact with daily activities. Again, family therapy, vocational rehabilitation, and supported employment in order to get them into the workforce. And assisted outpatient treatment is court-ordered treatment for individuals with severe mental illness. And this is a mental health intervention that provides the community and peer-based services. So this is a service that we have here at Live Right. We have an AOT program, and many of our AOT patients are diagnosed with some type of schizophrenia disorder. So that is one example as well of treatment. And this is just a summary of everything that we talked about today. And I'm going to open it up for questions, but I'll leave the summary page up so you can all see it.
You guys, if you have any questions, please feel free to unmute and ask. Or if you prefer, you can type them in the chat and I'll be more than happy to read them out. But I'll begin with the question. Can either of these disorders, whether it's bipolar or schizophrenia, is this something that you are born with, or is it triggered through some sort of trauma?
Yeah, so with bipolar and schizophrenia, there's both genetic and environmental factors that go into it. Schizophrenia, to my understanding, mostly is genetic. So that is a strong indicator when you are diagnosed. They ask you, does someone in your family history have schizophrenia? And if they do, that can be a very strong indicator that you will develop schizophrenia later in life. Usually this disorder is something that is developed when you get a bit older. So that onset, because of that older age that it's developed at, it's a little difficult to trace it back exactly whether it's environmental or genetic, but usually with both of these disorders, it's kind of an intertwining of both, if that makes sense.
So you will not normally see a child or an adolescent exhibiting signs of bipolarism or schizophrenia.
With bipolar disorder, you can get diagnosed with it at a younger age, but with schizophrenia, most of the majority of the cases, the psychotic episodes are going to happen at an older age. Yes, like 18 or older, I would say.
Okay, good deal.
Yep.
You guys, any questions? No questions? I'm really surprised because I just knew that there would be a lot of questions on this one. Okay, then.
Got one in chat.
Oh, one in chat. Okay. This was very informative. Thank you. Yep. And yeah, just to close out, I know it's a lot of information to take in, but these, because they are such complex disorders, they are very stigmatized. So it is important to do your research and to learn about them. So these populations, you know, are not stigmatized even further. So I'm very thankful that we had this presentation today. Thank you for having us.
And just to recap, treatment for either disorder would be medication and or therapy. And
Yes.
to the instructions on that to ensure your better wellness and mental health going forward.
Yes. Yep.
Okay, good deal. Well, ladies, thank you so much. Excellent presentation.
Thank
Thank
you.
you guys
Thank you.
for joining. And we will see you all next time on our social emotional workshop. Everybody have
Sounds
a good
good.
day.
Have a good day.
Bye now.
She's